Okay, so welcome everyone. I'm sure that most of you are returners, so you know the drill, but I will introduce everyone who's speaking today, and then they will begin presenting. And as we go throughout the presentation, you are welcome to put your questions in the chat. We will largely save them for the end of the presentation though, but you're welcome to type them out ahead of time so that you don't lose your train of thought. And then of course at the end, you'll be welcome to add more questions in the chat, or you can voice your own question aloud. But with that, I would first like to introduce Nicole Jedding. Like we just said, she is a former social science scholar who graduated in May of 2020. She is from St. Louis, Missouri. And when she graduated in 2020, she did so with degrees in psychology and public policy. To better emulate her hero, Dr. John Waller, she is currently attending the University of Oxford in England for her master's in evidence-based social policy, where she is focusing on the evidence to policy gap in legislation, attempting to combat the effects of redlining in Philadelphia. Nicole now spends most of her time avoiding working on her dissertation by Skyping her dog at home and staying up too late to watch American football. So thank you for being here today, Nicole. And then now we have Macken Keefe. Sorry, 1 second, I'm messing with Zoom. So Macken is a third-year student currently at MSU studying political science and international development. And besides studying and research, Macken is heavily involved in service through MSU's Rotary International, MSU's Student Government, Camp Kesem, and the Senior Ambassadors Program. In his free time, he enjoys golfing and training his puppy. Thank you, Macken. And then finally, we have Kate Frieden. Kate is a fourth-year psychology student here at MSU and is minoring in cognitive science. She plans to continue her education in graduate school to study social and behavioral mechanisms in public health and health equity, partly because of her involvement in this research project that we'll discuss today. So thank you all, and feel free to begin.
Like Emily said, my name is Nicole. This project is actually a baby from 2017, if you can believe it. It's 4 years old. It'll have its 5th birthday in January. And I started this from a scholar's sophomore year research project. It was a requirement. It wasn't something that I really had a lot of motivation to do. I wasn't too excited about it. And then as it kind of built and became something entirely different than anything that I ever would have dreamed of, it became one of my favorite things to work on in my free time. As you will see in a little bit, this took hours and hours and hours of both Kate Macken's and I's life to watch through a lot of these new segments. So it is definitely a passion project at this point. So I was interested in drug policy. Like they said, I was psychology and public policy. So kind of where those meet is drug policy. And especially in the United States, there's a lot of room for improvement on that front. And I also really wanted to do some novel data collection. So a lot of the times whenever you're an undergraduate, research looks like a literature review, or it looks like you collecting data for someone else's project, but I wanted to do something that was just mine, my own thing, that I could make into something fun and cool. So Dr. Waller and the ex-chair of the political science department, Dr. Charles Ostrom, were both instrumental in helping shape this into be what we will talk to you guys about today. Come on, VP. Maybe I can't actually change. Oh, there we go. Okay, cool. Sorry, I was figuring out slide controls, but the common conception standard story for crack cocaine crisis, epidemic, whatever you want to call it, from the 1980s. And that it was a very criminal justice, unsympathetic, harsh approach to drug use. There wasn't a lot of like nice, humanizing, sweet stories, no heartbreakers, tragedies whenever they were covering this in the 1980s. But when you compare that to opioid drug coverage in the present day, you think a little bit more about someone's mother, brother, sister who passed away tragically from an opioid or heroin overdose. So we were kind of looking at whether, I guess, that discrepancy actually does exist through the data, because there weren't any studies out there that had gone through the news broadcast and cataloged this. So a piece of that was sympathy. And then the other piece of that was whether race was also a discrepancy for the crack cocaine users in the 1980s versus the opioid users in the present day. Yeah, so we're just going to start with a medley of kind of stereotypical images that we saw on our news broadcasts. Just kind of set yourself in our mindset. So criminal justice in the 1980s, this is something that you would see a lot. The police are watching this crack block. There's a lot of very stigmatizing language. There's a lot of very like scary warning, criminal justice, retributive sort of things. News almost always had some sort of law enforcement pictured. So a lot of the times, this is, I think, in Los Angeles primarily. So you just kind of see that you have law enforcement involvement almost always with the user. And so kind of nope, there we go. Sort of a brief history for how the crack cocaine panic in the United States started. Many Americans were first introduced to being able to smoke cocaine, so freebasing crack cocaine, whenever a famous Black comedian, Richard Pryor, lit himself on fire after freebasing crack cocaine in the 1890s. And so kind of using this time point, we started thinking about media coverage in 1980. And then what really sparked it, though, was when Len Bias was overdosed on cocaine. He was a University of Maryland basketball star, and it was kind of like a big deal that this semi-famous person ended up passing away because of drug use. So that just kind of like sparked the nationwide panic and started putting like a little bit more highlight in the news. So CBS ran a 2-hour special called 48 Hours on Crack Street. President at the time, Ronald Reagan, started the Just Say No campaign a little bit after then. And national newspapers like the New York Times and the Los Angeles Times started publishing things like crack's destructive sprint across America and battling for customers, crack wars leaves DC under siege. So just very like scary, kind of alarmist news coverage. And so violent crime, it didn't help, had been increasing in the past few decades. And so that was kind of linked into this whole almost freak out over crack cocaine in the 1980s. So many news outlets were employing almost a fear, like as a prevention tactic. Like with cocaine, the message has to be, don't do it once. The drug can kill on the first dose. It was just very, very severe sort of coverage. There we go. So this is George H.W. Bush. He had a very, very famous news story of the FBI, DEA, maybe one of the two, did a drug sting, and they got this drug user to come sell them crack cocaine a block away from the White House, and it started a huge kind of more potent, if it can happen a block away from the White House, it could be happening anywhere. And then you can also see him in a news council thingamabob with the little sign, crack kills babies. And then if you contrast this with how the opioid epidemic has been starting, it isn't seen as like this criminal justice matter. It's seen as this very medical treatment based. It's just a very different frame. So the United States experienced the renewed drug crisis with opioid misuse. Starting around the late 1990s, news coverage didn't really start up until pretty late in the 2010s. It kind of flew under the radar for a while. And pharmaceutical companies back in the 1990s decided that it was going to ignore most of the medical community's concerns with the addictive properties of opioids, and they're going to start pushing them out and recommending that doctors start prescribing them more. And so as a result of that, we end up seeing a lot more opioid prescriptions at that time. So by 2016, around 11 million Americans had reported misusing opioids. So we have, sorry, I lost my place. So doctors and hospitals have been prescribing things like fentanyl and morphine and hydrocodone for a very long time. But this was sort of the beginning of people being able to take them home and have them more at their disposal and not having like doctor or nurse administered opioids. So people were a little bit more able to misuse them. And you couple that with the just like huge increase in that one, huge increase in availability and pill pushing, you ended up with this problem of a ton of opioids on black market and available to buy from people who don't need them and people who were prescribed them that didn't necessarily need them and got addicted. And then you start running into the problem of if you can't get opioids anymore, are people going to start turning to heroin because it's cheaper? And you, there we go. And then you started seeing this huge public outcry from all of this. You see everyone here marching on the, I do believe this is outside of a courthouse for the Purdue Pharma bankruptcy trial. You see people doing outreach and help for addiction, nonprofit treatment centers, things like that. You see the creation of these methadone-assisted, some medication-assisted treatment centers for people who are suffering from substance abuse disorders with opioids. So it was just a very different response than what you saw in the 1980s. Suddenly, we're not looking at criminal justice. Suddenly, we're looking at how can we help these people? What this is, addiction is like a third party. It's a separate entity. It's not the people themselves. So our project was basically looking for how to quantify that difference, that frame shift from this horrible, terrible criminal justice matter into something that everyone can buy Narcan now over the counter from your local Walgreens. So how did that change? Oh, this is a doctor who prescribed more than 500,000 pills in his time as a pharmacist, just kind of demonstrating that it was truly a saturated market, and it did lead to illicit drug use. Yeah, so this is just a quote for Mark Maurer from the Sentencing Project, and he's talking about when the perception of the user population is primarily people of color, then the response is to demonize and punish. And when it's white, then we search for answers. So the other backbone of this project, yes, we are looking at how the frame shift from criminal justice to medical treatment happened, but we are also looking at whether or not this frame shift potentially happened because the news media mostly showed Black crack cocaine users in the 1980s and white opioid users in the present day. So that's one of the proposed hypotheses that is pretty widely available out there, that because it was Black users in the 1980s, whether or not they were the predominant user of the drug, because they had that perception that it was Black users, that drove the difference in response from criminal to medical. So we ended up using NBC Nightly news segments. So this is just a throwback to our boy, Tom Brokaw. NBC ended up being selected mostly out of convenience's sake. So there's this web archive called the Vanderbilt News Archive, who holds NBC, CBS, and ABC news sources. But since we needed to go all the way back to 1985 through 1989, our options were a little bit more limited for who had the clips available for us to watch online. And unfortunately, neither CBS nor ABC had them available. It was just our boy, Tom Brokaw. So for also ease's sake, we ended up doing the Internet Archive, which is just a different something on the web that catalogs a bunch of these nightly national news segments. We wanted to go for a national news source just purely because more people would see it. We decided that rather than pick like a local municipality, and while arguably those may have more data for us, just like quantity of stories, because people of the town may know each other a little bit better, you get a little bit more specifics. We figured the generalizability of doing a nightly news source where it would reach the most people would be a little bit better for what we were trying to create data-wise for this study. NBC, just to cover our butts, was the, if not the most, it was within the top 3 most popular nightly news of all of the major networks. So they were perfect. And it was also available and searchable, which is key. We didn't want to go through and have to watch the entire nightly news broadcast an hour for every single day. We were able to just put into this little form and say, we're looking for anything that mentions cocaine. And then we put in our little time frames. So we went from 1985 to 1989, searched a 5-year period. And then you click on the search button and it spat out all of the results for us. So that made that part really easy. And so just so we were making sure we were catching most everything that we could, we did search terms such as cocaine, crack, addict, and addiction. And then later for the opioids, we looked at opioids, because those had 2 very different search results, painkillers, fentanyl, and heroin. We ended up with 281 results from the 1980s, and we ended up with 233 results from the 2010s. This is just the second one, the one that we did for the modern day. It was 2015 through 2010, not 2010, 2015. Oh, there we go, 2019. So the 3 things that we were looking at primarily were sympathy, race of users, and then checking whether the race of users matched reality. So for our first hypothesis, we were basically just checking that frame perception actually existed in the media. So whether or not the media in the 1980s usually framed the cocaine users in a more unsympathetic manner, social deviants, criminals, junkies, whereas in 2015 and 2019, opioid users were tended to be shown a little bit more sympathetic. They're someone's mom, they're someone's daughter, they're the victims of circumstances that are at least a little bit beyond their control. So for the second hypothesis, we're looking at whether the cocaine users featured in those news items in the 1980s, whether or not they were typically shown as Black, and then whether or not the opioid users in the 2010s were typically shown as white. So again, we are just checking whether that preconception that most of us already had, whether that was true and reflected in the news systematically. And then for the third one, we're looking at whether the media coverage actually misrepresented the racial breakdown of crack cocaine users in the 1980s, because in the United States, most of the population is white. So that would follow that most of the population of drug users would also be white. So we are wondering whether the racial breakdown of what people were seeing in the news actually reflected the reality of the racial breakdown of drug users. So for our methods, we ended up, again, like I said, we watched over 500 news clips. So it was quite a lot. But Mac and Kate and I powered on through, and there were a number of things that could exclude these news clips from being able to be used for our study. So first and foremost, we needed the news clip to show a human being, whether or not they were physically doing the drug in the clip. The viewer needed to be able to infer that that was the person who was using the drugs. So most of everything that we were looking for, it wasn't necessarily about the cold, hard, like reality of what was going on. It was what the common user was going to assume after having watched this clip. So a lot of the times the race, we weren't Googling about and seeing exactly like what race or ethnicity the users were. We were just, this is as a common uninformed user or watcher of the media, what would we suppose just by seeing this 2-3 minute clip? So we were looking for all of these for the race of the user. We were looking to see whether the person, the news broadcaster, anchor, whoever was talking about it, was being sympathetic towards the user or not. So this could be from providing a like a humanizing background, whether they're talking about them as the victim of harsh life circumstances or socioeconomic circumstances, or whether it was medical maltreatment, their doctor did something wrong. So for instance, a story could present a humanizing background referencing their upbringing and some financial hardships, or if it made a reference to a fatal overdose as a tragedy, or indicated that if this person had just gotten medical treatment, then this all could have been avoided. So just things that would make your heart tug a little bit if you're watching the story. And then conversely, they were unsympathetic if the journalist was kind of implying that the user ought to be subject to criminal investigation or persecution, mentioning involvement with police or courts, and when there aren't questioning whether like that's actually the appropriate venue to go through things. There are a couple opioid stories that they're talking about. Look at this poor man who had to go through the courts and they're putting him on trial for something that isn't his fault. So something like that we would have coded as sympathetic because the news anchor wasn't saying that that was right. That wasn't what should have been happening. Another tip-off that things were being unsympathetic is if the journalist called the drug user like junkie or an addict, or if they made reference to the user resorting to criminal behavior to support the drug habit, like if they were stealing from something. And then, yeah, if it was ambiguous, you weren't really sure, then we just coded that as NA. The other thing that we're looking at is responsibility was the other big one. And that was basically whether the drug user themselves was at fault for the drug use, or if it was extenuating circumstances, or like being prescribed some pills that they didn't necessarily need, or whether like a doctor or a third party or the government failing or something, who was to blame for the drug use. And then I've kind of already talked a lot about this, so I'll gloss over public health or criminal justice. We also collected some kind of exudant stuff. We looked at whether they were in a metro or non-metro setting. Just like, could we tell if it was rural? Could we tell if it was urban? We looked at the ages to see if it was like more adults or more teenagers or more children. And then we also looked at whatever we could deduce from socioeconomic status. The latter three we ended up not using as much because the results didn't quite fit into our hypothesis, but it was fun to kind of be able to quantify that and put that in. And then for the double coding, it was just to say that Kate, Macken, and I, we all looked at these things. One of the three of us, or two of the three of us, watched at least one of all of them. Okay, and then over to Macken.
All right. Hello, everyone. So I'll just begin by giving a little bit of a spoiler alert that first, our initial hypotheses and many of the common trends, common preconceptions were confirmed by the data that we reviewed in this study. So the first two are the findings that cocaine users in the period between 1985 to 1989, that period that we had discussed, were depicted as being far more deserving of blame and punishment than opioid users as compared between 2015 and 2019. And the second common idea, that Black people are much more likely than white people to be shown using cocaine during 1985 to 1989, was also confirmed by the data. And sorry, I just need to move people because I couldn't see that slide. So sorry. So as you can see in this graph, you can see that the frequency of news stories depicting, just as a common trend, depicting people had stayed, it was pretty volatile over time. I'm sorry, Nicole, could you give us some more information on these two figures?
Oh, that was just to show that what years, the kind of the distribution of news stories that we saw for each of these years. So you can see in the 1980s, there's kind of a spike in news coverage whenever Len Bias passed away. But other than that, it was pretty much consistent. The news was covering for our entire time period that we selected.
Right, thank you. I'm so sorry, I didn't have the opportunity to see this graph before I started this presentation. So that would be correct. And then during the opioid period, there were also a couple of high profile people who did end up dying and being covered by the news. One being the singer Prince, and then another being the singer Tom Petty. And you could see that there were relative spikes there as well during late 2017 and during 2019 at those points. So this is to just give an example of what the news recordings looked like as we were coding them. Each clip was about 1 minute to 2 minutes long. It varied between each clip, but that was the average by far. So during the 1980s, you would see these clips where very typically it would be pictures of people being lined up along walls and being searched by police officers. And you would also have stills of drugs that were seized, or weapons, or people being put into squad cars. And all of these reinforce that heuristic that there is an association between crime and drug use during this period. And you also have these catchy slogans that were reported by the NBC News reporters, such as "crack down" and all the other one-liners that they could come up with that reinforce these notions as well. And of course, these are cherry-picked images because there is some variability within the data, but these are just to identify the common trends within the data that we are going to discuss in a little bit. During the 1980s, you could find that most users were portrayed as Black adults in an urban setting and being framed as a matter of criminal justice, that apprehending these people was needed by the state in order to achieve justice and safety and security. 2015 to 2019 is a slightly different story, however. There's a lot more sympathetic photos that come about in this time, and there's a lot more humanizing stories. You see pictures of opioid addicted babies being born in the hospital and discussed as a threat to our future. You see more videos and pictures of clinics and other rehabilitation facilities for people who admit to using opioids and being addicted, where they can go and seek help. And these are seen as more popular, more numerous during the 2010s. And as I said, there's also more interviews with people who are described as being drug users that allow them to humanize themselves, explain how they got into these circumstances. One of the big distinctions is that humanization element, where during the 1980s, the people who were using the drugs were rarely, if ever, actually given the opportunity to speak to the news. It does happen, but it's very infrequent as compared to just videos of them being arrested and put in a squad car. And then during the 2010s, there's way more incidents of people describing how, oh, I was injured and then I got prescribed this drug and that's how I became addicted, or however else their story unfolded. So these are more of the common trends being described during the 2010s, where users tended to be more white. Adults and children were discussed, as I mentioned, with the opioid babies. The settings were majority urban, but there also were more rural settings. And then last but not least, everything was framed as a matter of public health, where we needed to be able to solve this issue in order to uphold the health and well-being of our society. Just to give you a review of the hypotheses that we originally established for this project, the first hypothesis is that the 1980s media showed crack cocaine users unsympathetically where the drug use was their fault, and 2010s media showed opioid misusers sympathetically where the drug user was out of their control. Second, that 1980s clips predominantly showed Black crack cocaine users, and 2010s clips predominantly showed white opioid misusers. And the third hypothesis, higher portion of Black cocaine users shown in media than real life portion of Black users. All of these hypotheses are reinforced by the data, as we'll show with the figures in just a minute, but it's really harrowing to consider the consequences of all of these hypotheses being confirmed, because not only is the news media misrepresenting the true nature of how many people are doing certain drugs, whether it's cocaine or opioids, but it also leads to that reinforcing effect of during the 1980s, drug use being associated with crime, as distinguished from the 2010s with drug use being associated with health and well-being. Let me move the camera again real quick. So this is a figure to reinforce the first hypothesis regarding sympathy. During the 1980s, it was only just above 20% of all coded clips had some indication of a sympathetic portrayal, as compared to the 2010s, where it was greater than 80%, almost 90% of all clips had some indication of sympathy for the user. And in order to illustrate this effect, I'd just like to read a couple of quotations taken from news anchors between these periods, just so you can understand the gravity of this difference. So during the 1980s, this is one example. May 17th, 1987, NBC News asked, "Why should we care about another superstar junkie, someone taller and richer than most of us, someone who dribbled away his dream by using drugs?" Another example, on May 16th, 1988, they described drug users as people who are willing to kill to feed their habit, or they'll turn on their family members or loved ones to be able to feed their habit as well. Pretty harrowing stuff, not very lightning portrayals of these users, and especially in comparison to the 2010s with the opioid users. To give a couple examples. On January 1st, 2017, NBC News described babies born opiate addicted are mostly babies from rural areas, and they're typically white babies that just their parents have, for whatever reason, they've gotten into the addiction that they are in. Or take on August 9th, 2017, where a sheriff deputy was described as saying, "We're not going to arrest our way out of this problem. You need to have access to beds and treatment in order to make this work." So these quotes, these are cherry picked as well. They're not perfect representations of their ability in the data, but they conform to this general trend that we identify, conforming with the first hypothesis, that the levels of sympathy vary dramatically. And then going to our second hypothesis, this disparity in the racial portrayal of each of these users. It's illustrated here in this graph, where you could see that during the 1980s, it was 42.5% of all users were portrayed as Black, shown in the clip, 42.5% of clips showed a Black user and a Black user only. 21.7% of clips showed a white user only. And then it was about 30% of all clips demonstrated a mix of races, usually Black and white, but a very, very small minority also had Native American, Hispanic, and other minority racial groups. And then take that in comparison to the 2010s, where you have 73.4% of all clips only show a white user, only 8.1% of the clips show Black users, and then again, it's about 15% that show a mix of Black and white, or those other minority racial groups that I described. And the most harrowing problem here is the fact that this is not representative of how many people were using these drugs in reality. Using survey data, we were able to explore the true racial breakdown of how many people were using each respective drug. This is just another graph, that demonstrates the trend that we find. We were able to compare it to true data of how many people were using drugs self-reported, and we find that there are significant disparities in the data conforming to hypothesis 3. So as you can see on this graph, the color green indicates the real data of how many people were actually using these drugs during the given time, and the white bars depict the depicted people of, according to NBC News, who's using these based off of who's represented in the clips. And these disparities are quite breathtaking, to say the least. And when I was watching these clips, I didn't really realize it either until we stepped back and saw this trend of Black, 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 Black for the 1980s. So during the 80s, it was only about 10% of all crack cocaine users were described themselves as Black, and 51.1% were white. However, according to the NBC News, as we watched, 42.5% of all users of crack cocaine are Black, as compared to only 21.7% being white. So the problem in that is that it's showing crack cocaine as this Black drug, where most of the people using it are Black, and tied in with that association of it being related to crime, that creates those problematic stereotypes that we've been discussing, when in actuality, that's not true, as shown by the data. There also is a gap during the 2010s, about of 8% of 8% of difference. During 73.7% of users are depicted as being white during the 2010s, as compared to only the true data, which shows that it's 65% of all users are white. But it doesn't have that quite inverted effect as does the 1980s. And that is something that is very, very breathtaking, to say the least. We also talk a lot about the responsibility. So there also is a gap in responsibility between each of the periods. It's about 62.5% of clips during the 1980s. Responsibility was put on the user's own choices, that it was their fault that they decided to take the drugs. and outside influences weren't cited as the reason that they took them. Compare that to the 2010s, when it's only 21% of users are shown as starting the drug use being their own fault. And of course, you can see the opposite effect with the other category, which describes the reason they started taking drugs was for some other reason besides for their own volition. 25% of users during the 1980s were shown to have taken drugs because of some other reason, compared to 2010's 71% of all users. So there is this gap that continues. And then there are 12.5% eclipse here and 7.1% eclipse here, where we weren't able to decide one or the other. It was too ambiguous to come to a conclusion. The locale was also overwhelmingly urban. There is a preconception that personally I had that crack cocaine was an urban issue and opioid use was a rural suburban issue. And for me, that turned out to not be correct. 85% of clips were demonstrated as metro, as compared to only 2.8%, which were shown as rural. 11.3% too ambiguous to confirm. And then that remains relatively similar when you look at the 2010s, where 62.6%, still a strong majority of clips were shown in a metro setting. And then 13.1% were shown in a non-metro rural setting. Just about a quarter of them we couldn't confirm, but there is still that similarity that this is a metro urban problem. So given all of this data that we were able to digest, it's very shocking to say the least. So with all of this, I'm going to turn it over to my colleague, Kate, and I'm going to need just a second to give her remote control.
Okay, hello everyone. Awesome, I can control the screen. Awesome, I hope I do this right. So I guess just as a discussion, like two ways that these nightly news broadcasts kind of like deviated from the norm, deviated from the data. In the second reason specifically, it was just a lot less sympathetic toward cocaine users, toward crack users in the 1980s. It was very clear compared to opioid users, where there was much more sympathy. And second, there was definitely an overstated link between being Black and using cocaine in the 1980s. That was, as Macken showed, not realistic and not representative of actual data. But by pairing the image of Black users and Black people with them using cocaine, it created this association that overwhelmingly this is a Black problem, and that Black people are the ones using cocaine. So we can see that it was a lot of white people. You can't attribute it to being a Black drug, but that definitely did become associated. Interestingly, I think powder cocaine just became associated with white users or more wealthy users. And so crack cocaine became associated with usually a lower income Black users. And this overstated link caused, at least in some part, or at least shaped users or viewers' perception of users as to be demonizing both cocaine use in general, as it was a bad thing that should not be happening, and demonizing Black Americans because they were the ones overwhelmingly using the drugs, which has some pretty severe consequences. Let me try to, Macken, actually, could you just go to the next slide? Thank you. So we took the data that we had and we tried to come up with, or at least theorize, why we got the results that we did, why NBC Nightly News was showing this differential portrayal in sympathy, differential portrayal in who is at fault, and differential portrayal at who the majority of the users were in terms of their race. And I want to preface by saying that these are not, we cannot take anything causal from this research project, so we don't know for sure or not. So we can't attribute one of these explanations solely to the results that we found. And second, that it's probably and most likely a mix of all these explanations, and that one wasn't the only answer, because all three of these definitely did contribute a role. So I want to talk first about anti-Black racism. There's a very considerable disparity in the degree of stigmatization of these drugs, crack cocaine and opioids, and we thought it could be attributed at least somewhat to racism. To give some background, the opioid crisis was originally reported on as being a problem in predominantly white and rural Appalachia. But so that's where it kind of gained the whiteness of the drug. And then when opioids like OxyContin, prescription painkillers, were introduced to the market, they were actually originally advertised toward a clientele who was technically supposed to live in suburban areas and who had private insurance, that they could have access to this drug. And so this technically excluded minorities and lower SES populations in the first place, just the way that Purdue Pharma marketed the drug. It's also possible that a racial disparity emerged in specifically prescription opioid use due to kind of implicit biases of healthcare workers who are less likely to prescribe high pain management meds to African Americans. That goes back to a long stereotype suggesting inaccurately that Black people don't feel as much pain as white people. And this is definitely not the case. I am running out of time, so I will briefly go over these other three explanations. So the second explanation that we came up with was the liberalization of attitudes, basically saying that over time, from comparing the 1980s to the 2010s, that in our society, there was kind of a trend of greater tolerance toward illicit drug use. And so that was a possible explanation. And the third explanation is that there is really a difference in the drugs and the legality. Cocaine has been legal in our country, criminalized in all forms since 1914 in the Harrison Act, whereas prescription opioids started off as a medical treatment and were illegal. And so that could create, that definitely I think did create some difference about whose fault it was, and if people should be to blame if they were taking something that was initially prescribed by a doctor for a medical reason. I do want to say that when you think about the opioid crisis, you think about prescription painkillers, but a lot of it is actually heroin, fentanyl use, which has always been illegal. But the fact that we think about it as prescription opioids itself kind of has to do with the whiteness of it all. So you can go to the next slide. We talked about some things in our conclusion that I want to share. Just to recap, we found that there was a higher stigmatization of cocaine users and opioid users from the clips that we watched. Blacks were shown a lot more in clips of crack cocaine, but whites were shown more in opioid clips. And there was a significant overrepresentation of Blacks as being crack users in the 1980s. And so kind of some implications for all of this. There are a few I wanted to touch on. So first of all, when you watch the news versus read the news, there is the whole component of seeing, and you're able to see clips and be able to see users and see environments, whereas you just can't get the same thing if you're reading the news. And so I think that actually pairing the image of Blackness, Black people, sometimes there were clips of people actually smoking crack or taking opioids. You're able to create a much stronger association between race and user. With the whole war on drugs thing in the 1980s, a lot of Black people were getting criminalized and being sentenced to like the minimum 5 years in being in jail. And so that kind of relates to, not kind of, it definitely does relate to mass incarceration and the whole idea that treating the problem of drug users, Black crack users, was to put them away and exclude them from society. So it wasn't their problem, wasn't our problem anymore. The race of the users that we all think who do the drug can shape health policy and what kinds of treatment policy is enacted. If we think a drug's mostly used by white people, we're going to eventually shape policies to help the specific group of people we think are using the drug. And finally, there's interesting, at least now, about, since everyone watches the news, or at least almost everyone is seeing these images and seeing these associations. And that doesn't exclude healthcare workers who can be the ones actually treating people for opioid use disorder or treating them at least for their addiction. And so if you portray a user as being their fault or it being bad, then you would think that it affects everyone, and that includes healthcare workers, and negative views of them and negative views of their patients could affect how they treat them, how well they treat them, and just the overall treatment in general. So with that, we're going to open it up to question and answer. I know that we went over our time, but we just had so much to say. So yes, we'd love to hear your questions. Thank you.
Great, thank you. All right, first question, we'll open it to Ren Mueller. He's gonna verbalize his own question.
Thank you. First of all, great presentation. So based on so you haven't done a causal analysis or even really any sort of correlations yet, which which is fine. I think I noticed that it seems like race seems to be your main hypothesis here based on the methods that you used and the data that you focused on. I think that, going forward, I would say going forward, there's sort of 3 other big hypotheses that I think are worth investigating, and you sort of touched upon them in your possible explanations section. The first one is, I think there's a good chance that we've gotten less, like American society has gotten less maybe judgmental about drug use over time, especially from the 1980s to now, so that even if like there were the same crises happening at the same time, there would be like general harsher views expressed in the media toward all drug users than compared to now, which is you can investigate that. A second would be the association with violent crime of the individual, of the different drugs. So I don't know the actual research on this, but I would hypothesized that people using crack cocaine are using it in, or that people using crack cocaine are largely using it maybe in a more urban environment. And then my understanding is that there are greater associations between use of that drug and violent crime than opiates, which may be related to the environment in which they're generally used, or it might not be. But I think both of those things can serve as sort of explanations for why there might be this difference. So I guess my main question is, have you considered those possible alternative explanations, and are you looking into ways to integrate that into your research going forward?
Yeah, so I guess I'll take that one. So they are definitely, as you said, there's nothing causal. We didn't determine exactly why this discrepancy exists. We just decided that there is a discrepancy. Truly, there hasn't been a lot of research in the space when the project started. This was like the first of its kind. So before we could tackle the question of why did this thing happen, you have to tackle, does this for sure exist? So that's kind of what the first step is. I would love for someone to do the things that you suggest. There was actually a pretty cool study who did like primarily white drugs for opioids versus meth use in the present day, but they used newspapers articles. They didn't use news media. So what they kind of found, again, supported our second potential explanation, the liberalization of attitudes towards drug use. They found that over time, I think it was around 2005, I could be wrong, don't quote me on that, the general populace was treating drug use a little bit less harshly. It was kind of a little bit more of a shift, even for the drug meth that has always been illegal, doesn't have any foundations in a medical use. So it's definitely a possibility. That study also couldn't do anything officially causal. I think it's pretty hard at this point to establish anything causal, because what you would have to do is have, like, you'd have to be able to measure like a different world for the implicit attitudes, like what would happen if we didn't have this liberalization of attitudes. I think that they're fairly hard to untangle. So I'd love for someone to be able to do that, but I'm not quite sure how a study design would be able to do that. But yeah, I definitely agree that the points that you made about race not being the be all end all of it is correct. There are other things that play into it.
I do think that, oh, do we have a question? Do we have another question?
Go ahead, Kate.
Okay, I was on Run's point. I do think that the association that was made between crack use and violent crime is something very interesting, and something that I found in my own literature review. I did a literature review about people's feelings and interpretations and perceptions of crack, meth, and opioids. And something that I found very interestingly, but makes sense, is that crack users were doing it maybe more in an urban environment, and that allowed for news media to kind of take footage of them because they were out in public, and something that kind of protected white users of using cocaine during that time, so that they were doing it in their houses, they were doing it in private. And so that kind of blocked, or at least protected them against the same kind of scrutiny. But yes, I think there was a big effort for the war on drugs to over-exaggerate the relationship between using crack and violent crime as sort of a mechanism, as a reason to support the fact that we should criminalize We should criminalize people who use crack. We should put them away because they are dangerous to our society, and definitely enforce the idea that Black people are criminals, that crack users are criminals, and that they are inherently they're scarier, and they will kind of be the downfall of our society because of what the drug is making them do. Of course, this isn't based in evidence. It was interesting because crack was talked about as being more scary, being more detrimental, and being more addictive than they had ever seen powder cocaine being used, but it's the same composition. So there's actually no way for that to even be valid. But yes, historically looking at the way that US treated crack users and linking it to violent crime was definitely a way, I think, to at least get support of the public for their policies of wanting to put users away. Because if you think that they're gonna come into your neighborhoods, that they're gonna hurt your kids, they're gonna be stealing from your stores, then you obviously feel like I don't want that. So definitely, I think that was a really interesting part that I found too, that I just wanted to share.
Okay, I have a question, which is, you touched on the fact that kind of the first wave of the opioid crisis began with prescription opioids. And so knowing that, and also knowing that there are racial biases in the medical world, such as the false belief that Black people experience pain to a lesser degree or differently than white people. Did you look at all at how prescription rates of opioids differed by race?
This study specifically did not. I actually did do something like it in a sociology class, and there is a huge disparity between who gets prescribed via race. So you see a lot more white users being, because I think Kate alluded to this already, but there was this theory that went around that Black individuals were more susceptible to getting addicted to drugs, which doesn't quite make sense. But that was a real fear that went around in the medical community for a while. So people were a little bit more hesitant to prescribe these opioids. There's also the thing of in aggregate general, Black individuals are less likely to have healthcare insurance. And so if you don't have health insurance paying, you probably aren't fulfilling a lot of your prescriptions. So they're just less likely to be taking these sorts of things. If the doctor assumes that you don't feel pain as deeply as a white patient was, then they're not going to prescribe you the higher stuff. They'll just say, go take some ibuprofen and go home. So there was a pretty huge disparity. I don't have the numbers in front of me right now. But yeah, it's definitely true that white patients were prescribed opioid pills a lot more frequently than Black patients were. And I do believe it's specific to Black patients, and that Hispanic and other populations had similar levels to white patients. It was just that dip in Black prescriptions specifically.
Yes, John.
Hi, yeah, thank you. I've read the paper, and I think it really is about the finest piece of undergraduate research I've ever seen. Really superb. I've been watching the Hulu series Dopesick, and I think it's really, really wonderfully done. But I think without exception, the opioid misusers are white, and of course it's set in a white rural area of a declining coal town. It's very, very sympathetic portrayals, I think you're quite rightly so, of the opioid misusers. Are you aware of any series that are equally sympathetic about African-American cocaine and crack users in the 80s? Does The Wire come even close to the same level of sympathy, do you think?
Well, it's in the 2000s, absolutely, in my opinion.
Mm-hmm.
I don't watch a whole ton. I personally haven't seen The Wire, so I don't know. But no, I'm unaware of any 1980s depictions of drug use. Maybe the TV is just a little bit before my time.
We were all too invested watching all of the news clips to be able to watch all of these drama series, so we apologize for that.
All of my nightly TV viewing was NBC Nightly News.
It was fun though, watching the clips, at least from my perspective. I really liked it. I thought that it was interesting to see the way stories were portrayed. Then see Tom Brokaw, Connie Chung, other anchors and reporters, see like what kind of footage they use, the quality, obviously with video footage being a lot clearer now, kind of being transported back into time and looking like over that period, like the things that happened. That was really cool. But also looking at it today was cool too. But I especially liked looking at the clips from the 80s. I'd go to my parents and be like, do you remember Len Bias? Do you remember when George Bush famously held up the bag of crack cocaine and being like, it's everywhere? That was cool.
I'm a little confused about your definition and use of the word opioids. You did include heroin and fentanyl. Did you make any distinctions, however, as you were watching the various clips between those that dealt with heroin, which I think is regarded as at least it's penalized as a more difficult use socially than is painkillers and so forth. Did you make distinctions between the heroin and fentanyl and other painkillers, the ones that the general population may have experienced more readily?
So I'd be willing to speak on that. Thank you for your question, Nancy. The short answer is no. And that is because in many of these clips, many of the users had already become addicted to heroin. And often the news anchors preclude that by discussing how they first used prescription opioids, or they talk about prescription opioids. So the problem is that prescription drugs and heroin became conflated with one another. And because of that, we wouldn't be able to distinguish between those two terms. So generally throughout the paper, we operationally define opioid as prescription or heroin, just because of that reason primarily.
Also, throughout the years, looking at every year from 2015 to 2019, fentanyl became more popularly talked about in the middle to late end of the time frame we were talking about. as an alternative and even as more potent and more addictive than prescription opioids, because it sort of became that once more prescription painkillers were being highly regulated by the government and by other doctors, that people were turning to other forms of opioids to still get the feeling that they wanted to. And so that was hard because different opioids, like different classes, were talked about differently throughout the years. But that's a great question.
I have one more question, which again isn't necessarily specifically about the news portrayal, but my understanding was that, like, you talked about the real versus depicted rates of drug usage among a biracial group, and my understanding is that during the cocaine epidemic, Black folks were more likely to be using crack cocaine, while white folks were more likely to be using powdered cocaine. And I also believe that there were sentencing differences between the two types of drugs too. Is that correct?
Yes. The tricky part with the difference between powder cocaine and crack cocaine is that as far as where we got the real numbers was a self-report, nationally distributed drug use survey. And they didn't distinguish between crack cocaine and powder cocaine. So there's really no way for us to pull like real numbers from that. And then it was kind of the same thing with the opioid clips, where the news anchors generally talked about the two in tandem. So we couldn't really like say definitively that this story was about powder cocaine and this one was about crack cocaine, in order to be able to like do some sort of subgroup analysis. There definitely is a sentencing disparity. I think it was somewhere around the realm of the average sentence for powder cocaine, according to like the government minimum sentencing laws. Powder cocaine was under 100 months, and I think it was like 89. And then crack cocaine was 115 months. So it's quite, I think of it, what is that, 2 years, 3 years? So it was quite a severe difference. And even to this day, there's about 80% of people in federal prisons and 60% in state prisons who are still incarcerated right now for drug offenses that are Black or Latino. So of the people in jail right now for a drug offense, 80% are Black or Latino, and only 20% are white. So going along with that perception of crack cocaine being primarily a Black drug and powder cocaine being primarily a white drug, it had like real world consequences for the types of people and the racial composition of those who are still incarcerated today, which is why our project is pretty cool, and can lead to some really interesting research too down the line for how these sorts of things affect policy and criminal justice reform.
Great. Thank you all so much again.
Oh,
Um,
I think Emily, Judy has a question.
oh, yes, go ahead, Judy.
I was just curious if you have been able to share this study with other, let's say, other departments at Michigan State, for example. You know, like I'm thinking, you know, the journalism group college, I don't know what it's called now. Or even the criminal justice. I just was curious if there's been any interaction between the various departments, and if so, what kind of things have come about at this point. I realize not a lot can happen yet, but has it started?
So the pretty cool thing is our paper actually got accepted to a journal, I think in May is when we got our acceptance. And so we're in the final stages of edits right now. So that'll be really cool. Coming out in spring, I do believe, is maybe summer is the issue that we'll be in. So after we get it all nice, tied up in a bow and published, it'll be a little bit easier to disseminate to different departments. I know, so I was political science and psych, Kate is psych, and Macken is political science. So we don't have a lot of reach. And a lot of the times in undergrad, it's just like who you know and who you have contacts with. So I personally don't think we have reached out to anyone yet. But after it gets published and it's more widely available, I definitely think that it could be a cool idea to hit up some other professors at MSU and see what their thoughts are on it too.
Okay, thank you.
And I'll just add very briefly, Judy, after we do have this go through the publication process and have it finalized, the Social Science Scholars Program continues to continue this research. We haven't decided in what scope or what capacity yet, but the program does have people from many different backgrounds, from criminal justice, political science, social work, etc. So these certainly are people that will attempt to recruit on the project, because as you're alluding to, they do bring unique viewpoints to the table and they bring unique angles. So it would be great to increase that diversity in our team. So we'll be sure to look for that.
Wonderful. Thank you all so much. This is significant work to be accomplishing as undergraduate and graduate students. So with that, we hope you will join us again next week.
Thank you, guys.
Yeah. Thank you,
Thank you
Nicole,
so much.
Macken and Kate. Wonderful work. And thank you too, Emily. Now you can get some rest. And I hope to see you all same place next week. Stan Kaplowitz, who is retired from the Department of Sociology, will be talking about his work on, I think, largely on social inequality, but I'll send an email tomorrow with more information. Okay. Thank you all and good night.
Have a good night. Thank you.